Hi everyone, this is Dr. Sharon Livingston, and I'm here with Dr. Ali Sherzai, and today we're going to be talking about facial fillers for deflation. So there were 3Ds, and last time we talked about descent, when the skin starts to sag, and about the thread lift.
Yes.
So you can see that on our site. Today we're talking about deflation, and say a little bit more about that.
Yeah. So just to kind of recapitulate a little bit. So we said 3Ds of holding the skin. One is descent. So that means once the skin gets older with descent, we just have to pull it back. The second is deflations. That means when we are young, when you're like grapes, and then we get older, we get like raisin. So we have to fill it back up.
Speak for yourself.
That's right. And the third one is degradation, which consists of fine lines, and then there's going to be sunspots and all the other degradation of the losing the skin, the texture and the quality. So that we're going to discuss that next time, how to fix that.
Okay.
So basically this is now, since that means we lose volume, so what we're going to do, we have to put back volume.
And that's why they call it fillers?
That's the fillers that comes back. And so it starts with usually, as the fillers, most of them are made of hyaluronic acid. Hyaluronic acid is one of those chemicals that actually it's already present in our skin, but when we get older, that the amount is going to get less. So some smart person said, okay, why don't we make it and put it back? So, and that's what actually we are doing.
So the different brands, I know there are a number of different brands, they're all hyaluronic acid?
There are some of them. One of them is called calcium hydroxide. Those are the one which is for deeper. It's a calcium-based filler, and that's usually given for deeper for bones. And that's why I've got something in the back. You can see like radius, which is here. That's a calcium base, which is given for deeper, for the jaws, for the chin, for the cheeks. And then we've got like Juvederm, which is basically make a different kind for different thickness for the cheeks and for the nasolabial fold, for the lips. And then also one is Bellatero, that's the one in the orange, basically, which is again thinner, which usually give it for the tear trough then, and sometimes lips, something when there we don't list that.
So just tell me, I see there are 3 different Juvederms.
So basically like Voluma is again thicker. This is again given, could be given for the cheeks and for the chins and for deeper structures, and when you really build more volume, called volume, and you have to give more volume. And the one that these ultras, ultra 2s and ultra 3s and ultra 4s, basically depending, the more ultra, the more number on it, that means thicker it is. So the ultra 4 is thicker, we can give it in the nasolabial fold. Then in the ultra 2, we can give it mostly in the lips. And there's another they make is called Volbella, that we can give it, Volbella, which we can give it in the tear trough too. So this, I like it because it's got different kind.
Okay, and so we've got Clarissa here.
Yes.
And she's come to you. Tell us a little bit about Clarissa. Why did she come, and what is she looking for?
Yeah, so now the person comes back, basically, she's pretty young, but again, when you come back on a person who already lost volume, so he said, okay, now we've got most common thing is the nasolabial fold, okay, we can give you some more volume. So basically, when it comes in the syringe, basically it comes back with a syringe like this. So as you can see, this is basically is 1 cc only, and it's not that much. If I can get this thing and put it on the tip of my finger, it's going to be probably about this much volume. Oh. So it's not a lot. So basically, but
it looks like more
correct.
Than a needle, but when you actually put it out,
squirt it out, it's exactly.
Little.
It's just this is only 1
like
cc. Exactly, it's 1 cc, and that 1 cc can go any places. So it could be in the lips, or it could be nasolabial fold, or it could be in the cheek. Depends. So more deeper you go, more volume you need.
Stop looking at my face like that. Where do you want?
Yeah,
no,
I should look at
it's
it.
Okay. It's okay.
Yeah. So basically, the more it is, so the more volume you need. Suppose if you need just a little bit of thing, you can put a little bit of filler around the hair. Probably one syringe is going to be good enough. But if you want to put like a build up the whole cheek, then it's going to have to put more. Or if you put a little bit around the temples, then usually we dilute it a little bit, and then you can spread it a little bit. Then it depends how much loss is there, and then you put more there. Lips, another thing, it depends how big you want. I usually don't like to make the lips too big, because it should look natural, even if it looks kind of exotic and more voluptuous, but it should not look like a duck.
Right.
And so one has to know about it.
Okay, so what kind of questions do people have about it?
Yeah. So basically, when the person come back and says, "Okay, am I a candidate for filler?" So the same thing that I look at them and they say, "Okay, have they lost volume or not?" So if there is a loss of volume, which is right here, or there's a temple, or the cheek, or the chin. Then he says, "Okay, yeah, I think you're good, but your chin is a little bit too far back. I think it's a good idea to put a little bit of filler there to bring it back to the rest of your river." Or if you want to get a little bit, build up more cheeks, this is another area when we get older that we lose some volume on the cheeks. So that's a good idea to put it back some in the cheeks to give it nice elevation and give that oval shape that normally we are when we are younger. We have got oval shape. When we become older, we become more square because everything drops. So this area gets bigger, and this areas get lose volume, so we get more square shape.
That's
so it's just want to bring back that nice oval shape, which is for the younger person. So we try to create that post the younger frame. And is that again to see the lips actually? That's the most thing. It's a very popular, and especially that could be any age basically. If you want to have if you have a born with a thin lip, you want to make it bigger. Yes, we can make it bigger. So for that, also we have got, depending, there are different methods of doing it. There are people that they kind of giving multiple injections to lift it up. I like to give fewer injections because the recovery part is faster and it's a little bit better. If I put more lip, what I would do, I would make a little injection here at the corner, and then one injection I can give the whole upper lip and give all the lower lip, and same thing, one from the other side, one from the other side. Sometime in the middle I can maybe go giving just another middle injection in the middle, or that way. But there are also different techniques.
So what's the most popular one? Lips, the folds?
Yes, lips are very popular, nasolabial fold, chin, cheeks, temples, tear trough. Those are the common portion. And the other thing is also under the eyebrows. One of the things is also once we get older, this is the area that we kind of lose the volume. So filling up just under the eyebrows, giving that nice lift on the upper side, really looks good.
Huh.
And that's one area that is also.
So you're really 150 years old, right?
Let me see. You look.
You look fantastic. You look fantastic.
Oh, the other places that are also very common, we call it 11 sign, because when you get mad here, you see these two lines which difference.
Right.
Botox will help for people who does not have too deep line. So that's basically what we're going to do. The Botox will help that. But once the lines are so deep, then the Botox alone will not get rid of that. So that two lines needs to be filled. So we can fill it up. And the other thing is also, which is popular these days, just fixing up the nose. So basically somebody has got a little hook in the nose, somebody has got a kind of a little down tip of the nose. What we can do, we can add a little bit of a filler right on the different spot of the nose to give them the nice straight nose. And also just to give it a little bit on the tip, so we can lift the tip up, we give it a little bit down, we give it around with frenulum around here, vermilla, which gives the tip a little bit up, so that will actually restructure. Basically, is called a non-surgical rhinoplasty, that we can do it.
Wow.
With the fillers. And also we can do it with the threads. Actually, we forgot to do it on the thread section at that point, that we can do it with the threads.
I can get back my little upturned nose.
Yes, you can do that. Yeah, that's one of the things, because when we get older, that the tip of the nose kind of drops a little bit. It's part of the drop.
Yeah, the descent.
So basically, exactly part of the descent. So basically, definitely we can lift it up. Combination of the thread and filler works very good, actually.
Very good. What other questions might they have about this?
Again, complications. Again, the pain. Usually they ask how painful it is. It's really not that painful, because once we make the puncture, once the material goes underneath, it's in subcutaneous tissue, it doesn't really cause much pain at that time. There's another physician who used the term, which I like the term, he says, aesthetically acceptable. So, so that's what I use. Yes, it is definitely aesthetically acceptable discomfort, which could be, it's maybe not bad at all.
Who's not a good candidate for filler?
Yeah. So again, basically for people who have got lots of volume, lots of volume. And also again, last time we spoke on the marionette line. Marionette line depends. You fill it up a little bit, yes, but if you fill it too much, your jaw looks really big and ugly, and you lose that nice oval shape that we want. we cannot get that because now you made that jaw too big.
Right.
So combination of the filler, yes, you can fill the marionette line plus the pulling
The
it up
lift.
with the lift. That will work much better.
Excellent.
That's the way. Oh, the other question that usually, of course, they ask is there a downtime? Really, no downtime. This is the good thing. You can have it and you can go to the party the same night. It's not a big problem. Bruising is a possibility. Somebody who's a bruiser, you could bruise a little bit, but the thing is, usually the bruises are not that big. Maybe a small little black and blue at the site that we do the injection. You can easily cover it with the makeup, so it's not a big deal.
And what's the cost?
The cost depending on the syringe. So we have got the syringe that basically between $650 to $700 per syringe, and then it depends how many you need. That will, of course.
So the least would be one syringe, the most might be 3 or 4?
Correct. Even half a syringe, sometimes I use it. Lots of people, they don't. Because if you go on the lips, you don't need
very much.
Full, depending if you need a little bit of lift, you don't need the whole syringe. So I use the other half, and then it's okay, we'll keep the rest for you so that you can use it another time for something else.
That sounds fantastic.
The other thing also with the fillers that we said that part of the deflation is that, so one is that these fillers. The other thing is that fat transfer. That we can make it probably maybe another session, but what we can do that so I can get the fat from your own body, from the stomach or from the lateral portion of the thigh, and then put it back where you are. That will be for people who really needs lots of volume. Somebody who needs like 10, 15 or 20 syringes to want to build up the whole face. To do it with these fillers is going to be very expensive. So I usually like to do it with your own fat. Take the fat and reprocess the fat and put it back. And I think that will be, we can get much more volume.
So the other question I have is how long do they last?
Yes. So one thing good with the fillers that is like Botox and all that, they last only 2 to 3 months. The fillers last about 9 months to a year, so that's a good thing.
And would that be true of their own body fat as well?
Correct. Yeah. So body fat, whenever you put your own fat, it's just not 100% of the take, because one time when we put, you lose some of it, about between 30 to 50% it takes, you lose the other one, and then every time you put it on, it takes a little bit more. So eventually it becomes permanent. So that's the good thing.
Oh, that's interesting. So I have a different question, and I've never asked you this before. Why do people tend to lose more weight in their face? You know, it's like, how many people you know, they say they go on a diet and it comes off their face and it's still on their hips?
Yeah, this is genetic. And this is different people loses in different places. So that's why some people lose it on the face, some people lose it on their thighs, some people lose it any place else. But it's genetic. It got more difficult to lose it in the butt or thighs. So it's mostly depending on your genetic. So that's what.
So not everybody loses first from their face.
Correct.
Oh, I didn't realize
actually,
that.
some people who've got fat face, they wanted to lose it from their face, and they can, because actually we do fat dissolve to kind of reshape their face.
Fat dissolve?
Fat dissolve.
So what's that? Tell us about that.
Yeah, so fat dissolve basically is the generic name, the brand name which made is Kybella, which is basically, it's a same enzyme which is in the gallbladder when we eat fat. This enzyme is the deoxycholic acid.
That is so interesting.
Exactly. So it goes back and dissolves fats. So somebody said, okay, maybe we can use the same thing to dissolve fat someplace else. So Kybella came with the first FDA approved version of the deoxycholic acid, so that we can inject and dissolve fat. But now
it's so interesting. Okay, so tell people how they get in touch with you.
Yep, so they can always go to online. We can have that. We can reach us there, or they can call us at on the phone 201 569-0920. We can do that, and then we can put it on the.
Yes, I will. I'm going to put it right on here.
Very good. So.
And so next time, and so thank you so much. It's always very interesting to talk to you. Next time, what are we discussing?
We're going to discuss maybe about the degradation. So we can discuss about the Botox. We can discuss about maybe one time about the lasers, peels, different type of peels. We can do that.
So next time we're talking about Botox, and everyone's heard about Botox, and now we're going to get the real skinny on Botox.
Yes.
Okay. Thank you very, very much.
Pleasure.
And I look forward to our next discussion.
Thank you very much. Thank you.
Bye, everyone.
Bye-bye.